Hi, and welcome to Mind Matters. I'm Wendy McCarty Van Bemmel. I'm the regional director of our 4 hospitals here in Central Florida: La Amistad, Central Florida Behavioral, Palm Point Behavioral, and University Behavioral Center. We provide a full continuum of care, mental health through substance use, from outpatient programs all the way through residential programs. We have something for any part of someone's journey, whether they're going through a crisis or need a little bit of longer terms. I'm so excited to be here with our guest, Renee Sherowitz, who is an expert in trauma-informed care and has a private practice here in Central Florida called RC Counseling. Welcome.
Thank you, Wendy. I'm so thrilled to be here. Thank you for inviting me.
It's so nice to see you and so nice to have you here too.
Thank you.
I'm super excited to talk to you a little bit today about trauma-informed care. It's something really important for people who are out there looking for services. What is trauma-informed care? We're going to get into it all. But first, I want to learn a little bit about you. Tell us about your background. Maybe tell us a little bit about who you were growing up and where you are today.
I'm originally from Michigan. I graduated, I'm going to age myself here, graduated in 1991, and moved here in 92. So I've been in Florida longer than I have in Michigan. I moved here.
I think that constitutes Floridian.
I would say so, yes. The weather is why I moved, for sure. So I got my undergraduate degree in Michigan, and then I got my master's degree here in Florida at Troy University. To think about when was the time when I graduated, it was 15 years ago. I've been in the field. And then before that, my whole background's with child protection safety, working with the Department of Children and Families before they privatized, and the child protection team at the Children's Advocacy Center for 7 years, and working at a psychological office. So my whole background has been in trauma, background in a college as well. So this is a very much of a passionate thing for me that I take very personally, and I want to ensure that my clients receive the best care possible.
That must have been difficult working for child protection and seeing, trauma in children as it's unfolding in front of you. What was that like?
So seeing not just the physical, but the emotional effects as well, and then having to interview the non-offending parent. This was all for law enforcement, and having to testify in the court systems as well, and legal documentation of everything. So documenting everything from medical neglect, Munchausen by proxy, which is not fictitious disorder with children, the physical abuse, sexual abuse exams, and so you name it, we covered it. So that's
tough. I know my background as a therapist who was in foster care. It's where I started my career. And, the one thing that really stood out to me is the resiliency of kids. I'd have kids on my caseload that have gone through maybe 3 or 4 things that if I went through one of them, I think it would put me in the grave. Like really, really horrible stuff that you might only see in movies. And this was happening over and over and over again to a lot of the kids.
Yes.
And we're removing them out of their homes and then putting them in a foster care system and getting to see firsthand like how they adjust. And then they have to adjust to a foster family that is so different. And what also stuck out in my mind, too, is that you always have this love for your biological family.
A lot of people do not understand that.
Yeah.
The attachment.
That's the one thing I learned is that no matter how poorly you're treated, there's something innate inside of us that's humanness that wants to have a connection.
Yes.
Well, that's what I saw.
100%.
And in my own experience, too.
Because logically, it doesn't make sense to the average person.
How could someone do all these horrible things to you and you still love them?
Yes.
And then for the individual who's the victim, it's like, why do I feel these things?
Right.
What do you do as a therapist in those situations?
So one of my specialties, my main specialty right now, is working with victims of narcissistic abuse. And so you have to look at all the attachment components related to what you're speaking of. So 100% the attachment. So looking at it and then being open-minded to seeing this toxic behavior was not okay and I didn't deserve it as a child. And then understanding the radical acceptance that it takes to separate their behaviors from the person who is their parent.
Wow.
And that is tough. It's a grieving process.
Yeah.
It truly is. And understanding the biological, physiological component of wanting that relationship. And when parents, if a child decides, I don't want contact with that parent any longer, it's not a flip decision. It's something that's it could be years and
I think
years.
adults grapple with that.
100%. And so that's one of my main things is, working with the people who I see, looking at the attachment. Why do they feel this way? The physiological. So I'm very holistic in my practice.
Yeah.
Mind, body, spirit. You can't do one without the other. I love, functional medicine, integrative, sound bowls, energy, anything that's natural and holistic. Because when you have the trauma, you're dealing with the physiological changes from childhood. So a lot of my adult clients, if they have had a narcissist parent, the consistent withdrawal from one of the parents, possibly the silent treatment, is horrendous for the child. And then you're going to have a lot of changes to the brain as well as the body, your endocrine system, your hormone system, the cortisol levels, and then getting into, as a female, perimenopause and menopause, you already feel like you're probably going crazy because of all the hormone changes. Add trauma, 20, 30, 40, 50 years of the pre-trauma.
Wow.
It compounds it.
I just read this article, too, that was on generational trauma and how it lives in your DNA.
Oh, my gosh.
How interesting is that?
It's epigenetics. And I read an article, too, about the heart.
Sense.
The heart has cells that have memory.
Yeah, I just read that, too. How interesting. And that explains how a transplant.
Yes, people have memory.
You have the feelings of the person that came from. Very interesting stuff. And very cutting edge.
It is.
Yes,
it is.
I like reading that stuff, too.
So as a holistic therapist, I like to do the physical as well as not just the talk. Talk therapy doesn't move trauma in the body, because when you have things happening, that's trauma. They're not events that happen. It's actually the way the body receives the information. So if I was in a car accident and you were with me, I may be, a mess, and you'd be like, oh, it wasn't a big deal. Mm-hmm. Why is that the difference? It's all the different things. Perceptions. It's a life and death situation that I'm perceiving it as.
Yeah.
What was my past looking like for trauma? What was my prior exposure, genetics? So you have to look at all those lenses.
Interesting.
Mm-hmm. So it's not the event. It's the perception, the physiological response as a survival.
So for someone who's maybe had one or two tremendous traumas in their life or as a child, like, where do you start, or how do you look for getting treatment or finding some answers?
So that's a really good question, because it's really, you have to be informed to know what questions to ask.
Okay.
So if I'm looking for a new therapist, I need to know you're trauma informed. But what does that mean?
Yeah.
And trauma informed is, I know what trauma is.
Trauma informed care is a type of...
It's a type of therapeutic intervention, per se, in the way I'm going to treat my client. I treat all my clients as if in that lens.
Okay.
Because who doesn't have some sort of a trauma from any childhood to adulthood kind of thing?
That's true.
And looking at them holistically. Because if I have like anxiety can show up as physical, right? Not just, the mental aspect of it. And so I have to look at that person holistically, not just what the behavior is.
Gotcha.
If that makes sense. Yeah.
No, that totally makes sense. And brings my mind to, you have a kid in school who's acting out.
And now, where's this coming from?
Right. So the grades have gone down, behavior is bad, they're getting study hall, they're, getting punished. But if we don't ask those questions and really kind of
go
underneath that,
because there's no such thing as a bad child. The question is, what is driving that behavior?
Yeah.
And you spoke of foster care. I have a special place in my heart for foster care, because that was where when I worked for DCF, it was foster care and adoptions. And I learned a huge lesson. These two little boys, where one of them was just off the wall, but you're like, oh my, he's got ADHD, right? And then I'm like, oh, no, he witnessed severe domestic violence with his parents. There was the removal of one of the parents. There was, trauma. No wonder he couldn't sit still. His nervous system was off the charts with hyperarousal.
Wow.
Hypervigilant. Can't concentrate.
He biologically cannot.
Correct.
Yeah.
Correct. Yeah. So is it ADHD? That's a question we have to ask ourselves too, as a parent and or caretaker.
That's interesting. Yeah, we see so much diagnosis these days of ADHD, overdiagnosis,
Yes.
or
Here's a pill.
please give my kid. Yeah, they have so much energy. Please give them something. And then
Yes.
we have kids who are sedated, who are on, things that they probably don't need to be on. Do you see that in your practice at all?
Oh my gosh. And it's horrible to say when I was with DCF, and I'm sure it probably continues, they are one of the most over-medicated population that we have is our foster care children.
Really?
Yes.
Why do you think that is?
To be managed because they're having behavior issues, behavior problems, and they don't know the caretakers. It's too much for them.
Yeah.
And I can appreciate that,
Right.
but they need that support system. And drugging, it could help a little bit, but not these hyper dosed, medications that they're giving them. That's not okay for long term.
It's hard to deal with the trauma as a therapist for someone who has no stability in their life. You're teaching them, I'm assuming, coping mechanisms, but you can't necessarily pull them out of what their environment is.
Right. So that teaching them the skills to be able to respond to what may happen. Like I can't control that person, but I can control the way I react and respond. But sometimes those behaviors, like the fawn, faint, the fight, flight, freeze, and all those things, if I'm fawning, which means I'm giving in, or I'm just, I'm people pleasing, that could actually save somebody's life when they do that behavior. So those things are not like, don't ever do it. You have to look at the situation, especially in domestic violence.
Ah, that makes sense too. I never thought of that. Yeah. And I think the importance of having someone that cares about you, supports you, goes a long way. I remember being a new therapist and, I had all these things that I learned in school and I was so ready to use them. And I got my first client. It was a 4.5-year-old and I was like barely 20 years old and I was ready to go. I had all my curriculum ready to go. And you know what's coming next, right? Yeah. That first session, he wasn't doing anything that I wanted him to. I was trying all my techniques, using my modalities of treatment until I took a deep breath and I sat with him where he was.
That's tough.
Put that to the side. Not that technique's not important because it really is.
It's like taking our egos aside.
Yes. And just taking a deep breath. And like he could feel that. Once I settled down, he settled down into it. So I think the importance of, on a human level, just being there and absorbing the space with someone.
Just being there and regulating your arousal state and allowing them to just be with you is key.
I agree. And I think that's one of the key elements to, one, finding a good therapist and connecting and being able to have a positive experience, whether it's inpatient, whether it's individual counseling, but connecting with someone on that kind of levels and knowing they're there for you.
And not having expectations of them because they have so many already on them, they believe. Like I have clients, I'm like, okay, I'm not a big homework person, but I would encourage you to A, B, C, or D, right?
Okay.
And then they'll come back, I didn't do it. I know you're gonna be mad at me. Never, ever.
Right.
But they have this belief system that I'm going to reject them or disapprove that attachment stuff because that's the way they were raised, or that's their belief system.
Oh, that's so interesting. And then tell us a little bit more about attachment theory and what that is.
So the attachment, like Bowlby and Ainsworth, those are the two main people.
Say that again.
John Bowlby and Ira Ainsworth, those are the theorists in the attachment theory stuff.
Okay.
And you look at the different types of attachment that a parent and child can have. So just some of the main ones are like the anxious, avoidant, disorganized. You can have anxious, avoidant as well. So a typical one would be if I'm a child and I'm being raised, like say a single parent, and let's say that single parent is an alcoholic. And some days they're home, some days they're not. I have to take care of myself. Maybe that parent may hit me one day and maybe not. So I never know what's going to come at me. I don't have that stability and consistency. So yes, I really want that loving attention, but I'm also kind of scared of it because it could flip. So I may be more avoidant. I like it, and I'm going to be drawn to that, but then I'm going to pull back. And I see that a lot with clients as well. They're anxious. They want that attachment, but when they get too close to it, ooh,
So a pull,
it could be a push-pull.
and in their relationships
Yes.
later on,
Later on.
maybe with a romantic partner or,
Yes.
you know.
It's physiological.
Yeah.
Yeah, absolutely. And then we are also attracted physiologically, it's not conscious, to the familiar. My body is familiar, even though logically, I don't want to be with the person who's abusive to me. That's a logical thing.
Right.
But I find myself physiologically attracted to that, like the human magnet syndrome. There's a book, it's awesome. And the way I was raised, I don't want to be with a partner that was like what I was raised in, but I find myself in it.
It's familiar.
It's familiar.
Yeah.
Right.
You know it.
Yes.
Yeah.
And that's one of the things the habits to break is, okay, this feels familiar. Why? Ask myself, why does this feel familiar? The physiological components are with the mind-body connection, like the somatic stuff. I'm really into getting more into the grounding, the somatic, the mind-body connection. So when I do my techniques, like I'm trained in EMDR, accelerated resolution therapy, you're not just doing the memories, you're grounding your physiological body as well. So if this memory, when I think about it, causes me distress, my heartbeat goes really off the charts, I can relax that. And with the eye movements are amazing.
Okay, so walk us through. Say we don't know anything about what.
And yes, that's just it.
Yeah,
Okay.
yeah. So somatic.
Somatic is more physical grounding of the body symptoms of hyperarousal. So as an example, with accelerated resolution therapy, which is a derivative of EMDR,
Okay.
I'm going to have the person remember a traumatic event, and I'm going to do the eye movements as they're visualizing in their mind. And then after so many of the eye movements, I have them take a deep breath. What do you notice in your body? And then they'll say, well, my heart's beating really fast. And then I'll do a metaphorical tool like, hey, okay, your heart's beating really fast. Maybe visualize a speedometer going from 100 to 90 to 80. So that reduces it as I'm doing the eye movements and they're visualizing that. So you got the memory as well as the physical connection. So you're getting that lowered, the hyperarousal state.
So it's actually working inside of your brain on the things that are just ingrained from that trauma.
Yes, because you're remembering things in the amygdala, which is, the alarm system, and your hippocampus. The hippocampus is the cabinet, the filing cabinet for all the memories.
Okay.
And those are going to be enlarged more so than the frontal lobe, because the frontal lobe is your impulse control, your decision making, and all that. And when you have your frontal lobe isn't able to be as responsive as those other parts, you're going to be more impulsive and hyperactive. So we want to reduce that part and increase the frontal lobe aspect of it as well. So it's all a combination of those things.
And it's so good, I've heard too, for people who maybe aren't as comfortable talking about their traumas or are afraid to come to counseling because they don't know how to release some of those emotions. You don't really even have to. It's more physiological.
Yes. With my ART clients, I've actually had people, military, they can't tell me what their experiences are.
Stuck that
well, no, literally they can't.
Pushed it down. Okay.
No, they can't because of the military component. They can't tell me where they were, what they did.
I understand.
So I've actually had people not tell me anything. And then I walk them through it, and then it's no longer. I actually had somebody diagnosed with PTSD, and after just one session of what he did, he no longer had any of the symptoms. And every week I'd be like, okay, let me go through the checklist. Nope, nothing.
In one session.
I don't guarantee it, obviously.
Of course, everybody's journey is a little bit different. But I know working in the hospital system, we work with a lot of veterans who experience PTSD and non-veterans that are experiencing PTSD too. And it's, seeing someone who's stuck and doesn't really know how to make some changes or, how to get that away or step out of that a little bit. So I can see this being something really beneficial.
I mean, I have people that don't believe it at first. And they'll say, oh, you're going to see me for a long time. And one person I literally saw 3 times. Yeah. One time was the intake. The next 2 sessions were 2 different scenes we processed, and she was done.
It's such amazing, amazing stuff. I know all of our therapists and our staff at each of our facilities just became trauma-informed certified for everyone. So it's been a huge benefit to our patients that are in the facilities and really understanding. Because a lot of times in our acute care setting, we only get to see people for maybe 3 to 6 days.
Temporary.
So we're working with individuals who are either feeling suicidal or, have had their first psychotic break, those type of things. And, trauma is a big piece of that, and understanding what's going on in your body and then helping them get to a point where, they can regain some of the things that they've lost is so important. Yeah.
100%. Coping skills, grounding skills, all the above.
Yeah. Yeah. So what made you as a therapist go into trauma-informed therapy or specialize in trauma?
Well, I think my own personal background, just with different events and exposures I've had growing up as a child and all the different environments. And I wanted to ensure that the people that I worked with had a voice, that they were validated, that there were people who could help them. I grew up in an age, when I graduated in 87.
Yeah.
So in the 80s, people didn't know about all this stuff. They didn't know how to help.
Yep.
And so it became more of a crusade for me to ensure that other people received the care that wasn't around when I was growing up.
It's really changed. I feel I work a lot with young adults and kids in high school, do some talks on suicide prevention. And it's so different from when I grew up. A lot of the kids will come up and be like, hey, that was amazing, or they'll tell about their experience, and it's almost like a badge of courage and pride, and they feel good. Like, I see my therapist. I'm like, oh, I see my therapist too. And I know it's not across the board, but I see such a trend now, positive talk about mental health and our own personal journey. Or when I grew up, versus you wouldn't tell.
Being a therapist.
Exactly. And I love that. It gives me so much joy and also encouragement to see this younger generation coming up and being confident in talking about their experiences.
I would agree 100%.
And knowing they don't have to stuff it all down and compartmentalize it, which I think a lot of people in our age group are have done that in the past.
Suck it up, buttercup.
Yeah, that's how we grew up. So it's important to see that change happening, but also know what to do for individuals that, might not have grown up like that, and what they can do to kind of figure out what the trauma is and then move forward and know that there's hope. There's hope out there.
When I see people that are my age and older, and if they have no real experience with therapy, they literally will say, am I crazy? And just to hear when I tell them, and some of them just sob like, I'm not crazy, because they feel like they're going crazy.
They've had that weight on their shoulders. It's their fault.
Yes. And they may have been told it was their fault.
Yes.
For years.
Yeah.
And I'm like, no, this is because of this and this and this. So the validation is so important for people to hear.
I think so too. Do you ever do any work with families, and how do you bridge that gap? Say you've experienced family trauma and, years have gone by.
Mm-hmm.
What do you do with families in those situations?
So families, the one thing is each person has their own perspective and viewpoint of it, that even though I was raised in the same home with my sister, with my parents, we had different views of things.
Yes.
I was there, but you're going to see things differently, and that's okay. You're not right or wrong. And that is a huge thing for people to understand, because they want the other person, the family, to validate that, no, this is the way it was. Well, it was my perspective. And it's a shift for them, that it wasn't right or wrong, that your story is right, my story is wrong. It's the way we perceive it, and just we're individuals. We're going to see things differently, obviously.
Yeah.
So that is a big key. And with families, increasing the empathy for one another is huge.
Which can be really hard to do when you're holding resentment and legitimately bad things have happened because of a parent or because of a grandparent.
And that radical acceptance, too, like I mentioned before, that my parent, grandparent, whomever caused harm or in whatever, area, that the radical acceptance that they're who they are, that they're not going to change, that if I have that expectation and hope that they are, that's going to keep me from healing.
Mm-hmm.
Because it is.
Yeah.
That having hope can stunt my growth.
Mm-hmm.
if that person, their behaviors never change.
Yeah.
And,
true.
and I hate to say, hope, because I don't want to say don't ever hope, because
Right.
that's not what I'm trying to say.
Right.
But if a person this is who they are, and they haven't shown you any change in years, then the expectation has to be they're not going to change.
Yeah. And you're kind of allowing yourself in a way to be manipulated or, hoping that they're going to change and then they don't.
And just be disappointed.
Yes. Kind of consistently over and over and over again.
Yes. 'Cause as a child, we have needs. We need this from our mother or father. And if I don't feel I'm getting this, then I may feel resentful. I may feel disappointed, angry, or rageful. And if I can taper that and be like, okay, they're a human being. They may not be capable, or they just aren't. It has nothing to do with me.
Right.
Because as a child, we're hardwired to believe that it's because of me. I'm bad. I'm this. I'm that. Because it's a survival thing.
Yeah.
Yes.
And you believe what your parents
And you
tell you.
believe, absolutely, because it's that physiological connection for survival. It's innate. And so if I can move out of that and understand that it wasn't my fault, it's not about me, then we can get the growth and the healing from that trauma.
I think that's so powerful, what you just said. And I know for my own personal journey, it helps to think about, just for me, understanding where they came from, like how they were raised, the struggles that they had, the traumas that they have developed in their own life as a child play into part how they function as a human being too. It doesn't make it right, but it helps you understand it a little bit too.
So you don't take it personal.
Right. Yeah. If you were neglected as a child and your mom was working 3 jobs on her own and just trying to keep food on the table, her hierarchy of need was a little different too. So it was probably hard for her to have, that time with you or the things that you need as a kid.
Mm-hmm. And neglect is invisible. We don't see that as trauma. And I'm so glad you said that, because we see trauma as I can see it.
Yep.
Whereas neglect or emotional abuse, you don't necessarily see it. So the neglect component can actually change your physiological system. Wow. So look at the epigenetics and, from the whole research from the Holocaust and how the epigenetics of the trauma is in the genes, and it can change as well. But our brain has neuroplasticity, and so it has the ability to heal and change.
Isn't that amazing?
Yeah, so we're not hardwired.
Exactly. And that's where I think the hope comes in.
Yes. Absolutely.
I am a strong believer that you can do and be anything that you want to be. Yes. And I know some people would say, I don't believe that, but I really do. Like, it doesn't have to be the same as it was.
The mind is a very powerful thing.
It really is.
And if I say to myself, I am, fill in the blank, whatever that is, my brain believes it. Mm-hmm. So the power of our thoughts and what we say out loud, our brain's constantly picking up. So we have to be very mindful.
Agree. And it doesn't happen overnight. I feel like it's small little changes, like being, even if you're like, I don't believe this, I don't think it's true, but I'm going to do one little thing to try and make this the life that I want it to be. And if you do those little things by going to counseling or even just seeking out help or realizing, hey, this wasn't my fault.
Yeah.
It's changing those synapses and what's going on in your brain.
And also too, there's not a one size fits all therapist. So I could be the most knowledgeable about trauma.
Yeah.
But if that person does not connect with me, then I encourage them, find someone who you connect with, because that connection is more important.
Yeah, that is
in the healing.
I'm glad you said that. It is, because every therapist isn't going to be the right fit. Yes. And I think people are, they'll go to therapy and they're like, oh, it just wasn't for me. Well, you didn't find the right therapist. Right. You gotta. I think I tried out like 3 or 4 therapists before I found one that really fit who I wanted to see. Mm-hmm. So I think that's a big piece of advocating for yourself when you're looking for treatment. And same with treatment programs. They're not all created equal.
100%.
You have to find the one that's the right fit for you.
100%.
And I think some of the things that I would recommend looking for is when you're looking for a program or you're looking for a counselor, go in and talk to them first, or take a phone call, ask for a tour of a facility. I know when I was looking for a therapist, I always looked at the picture. Did they have a dog with them? Did they, you can learn a lot also in your therapist's office. I would look around the room. Okay, what books are they reading? And, finding that connection, or where I felt comfortable with even like just the aesthetics of the office. I could tell you in 5 minutes whether or not we were going to connect or not.
Yes.
Yeah.
The books, and just like, what is the therapist doing to increase their ongoing education on different topics?
Oh, that's a big piece of it too. Yeah. Yeah. Were you a expert on everything? Because no one can be an expert on everything. And that's hard when you look on psychology today. There's 20 things listed under your therapist, and you're like, I really need someone who's LGBTQ, or, you want the specialist, or for narcissism. So I would recommend that too, is finding someone who specializes and has a certification in the niche that you're looking for.
Yes, and that's where I'm in the process of getting my certification with Dr. Ramani. I can't never pronounce her last name, but
I can't help you on that.
But Dr. Ramani is like one of the experts, and I saw her in person up in North Carolina for a weekend. She's just fabulous. Read all her books. She is the epitome of knowledge of it.
Okay.
I just love her because I read all her books. I have a list of recommendations that of all the books I've read, like at least 20 to 30 books. I'm constantly educating myself. So just because you may have familiarity, even personally, with different populations, whatever you say you're specializing in, you have to consistently go and do more research and education on it too, because things change.
Yes, that's it.
And one of the words that Dr. Ramani uses is not just the narcissism, like toxic behavior, but antagonistic behavior.
Oh, tell us a little bit about that.
So antagonistic behavior is like the antagonizing of like the toxic things of criticism, contempt, entitlement, grandiosity. And like with narcissism, there's not a one size fits all. And typically narcissists don't go to therapy because there's nothing wrong with them, right? Unless they have to. And so I see some people and I'm like, okay, that sounds like this, but it's not grandiosity. Covert narcissism / vulnerable narcissism is one that people will miss because they're more this way than grandiose. Sometimes they're grandiose and people don't see it for what it really is. But I don't diagnose people, obviously, that I don't see.
Right.
But I encourage my clients, if they're in an antagonistic relationship, check this out for yourself. I'm not diagnosing anybody that's not in my office.
Right.
If this makes you feel yucky, why? What is it? Are you having to take the blame for things? Are you being criticized? Is there contempt? Gottman, I'm training level 1 Gottman with couples counseling. I don't do couples counseling, but I see some people once in a while. But it's contraindicative for couples if there's domestic violence, like domestic violence, but it's ongoing because if they're having that narcissistic like a psychopathology, antisocial, or whatever kind of behaviors, because they don't have that empathy. They don't have, they're entitled. And
Do you find that people who have childhood trauma are drawn into relationships with someone who is a narcissist?
They can.
Okay.
Everybody could be possibly a target of narcissistic abuse.
Okay.
The person who has narcissistic traits and or is a narcissist will be drawn to what it is they need from you. So if you have power, money, fame, and I want that, I'm going to be drawn to you for that.
Okay.
So it's like, or the empathy, like therapists can be targets for a narcissist because we have so much empathy. We want to help them. And we want.
Interesting.
I've known a few people.
Okay.
And I'm like, I was willing to even, hey, I'm doing this training. I'll give it to you for free. Well, I don't think I have anything to work on. And I'm like, okay, you just told me about all these things from the past that were traumatic, but you're
not
okay.
getting the accountability.
Nothing.
Or even having an inkling of their
wanting to change, that there's something going on that I could use the help with. They're not willing to be vulnerable.
How do you identify if you are in a relationship with a narcissist?
Do I feel like I'm going crazy all the time?
Yeah.
Do I feel like I'm in hyperarousal state? I'm walking on eggshells? If I say I'm processing in my mind the questions I'm going to ask this person before I ask them, so that I don't get in trouble or feel attacked. Is this person going to be defensive? If I say, you know what, Wendy, when you said that to me, I felt really hurt. And the narcissist would be like, what? I was just joking. And so, and minimizing, or they can get defensive. Well, you say it. You say those things to me.
So putting the blame back on them.
Right.
Okay.
So there's lots of different things that people can, like, and they're in these relationships, they're constantly questioning themselves. They're anxious. Their bodies are tight and tense. And their cortisols are off the charts. Are you, sleeping, not sleeping well?
Yeah.
Always got to make sure everything is okay.
It's got to be a thing to kind of when they come to therapy, and then realize, oh my gosh, this isn't me. Or, I'm in this type of relationship. And then you can start working on it.
The trauma bond, though, is what keeps them in the relationship. Logically, they know this person's not healthy. They have these toxic behaviors. But the trauma bond is physiological. So, like, the love bombing that can happen in the beginning of a relationship. Oh, I met my soulmate. This person's wonderful. I went on vacation. Everything. And then they pull back. So the dopamine, the oxytocin, the endorphins all go up. Then they come crashing down because they withdraw. Now my cortisol level is high and I crash down, and then I'll do anything to get that back. So it's a back and forth.
Highs and
lows. And so now it's a physical reaction and response.
That makes sense. And that's how you continue that cycle over and over.
And why it's hard to end that relationship.
Yeah.
People will end it and they go back. They end it, they go back. So
which is hard for people to understand why you would continually go back.
He's a jerk. Leave him.
Yeah.
The worst thing that people can do is judge that person.
Yeah.
Because that makes they won't reach out for help then if they feel judged.
Yeah. And I can tell you, I'm a therapist and I know all the right things. And when I have a friend that's going through anything like that, your instinct is just like, you don't deserve that. Yes. Like, you have to get out of this.
Of course.
What's the best way to help someone who's in a relationship like that, as a friend or as a sister or as...
Be there for them no matter what. And no judgment. I told you he was going to do that again.
Yeah, we knew that.
Nothing.
This is the 5th time.
Yeah. Catch yourself saying those things because that's just going to make them feel judged and less than.
Okay.
So don't offer them advice unless they want it, but don't expect them to follow through with it.
Okay.
And the biggest thing is, I'm here for you if you need me. Is there anything? And then ask them, what is it that you need from me? Maybe there's something specific. If you just want to talk, even if you've heard the story 10 times.
Yeah.
And it could be like, oh, Lord, here we go again. They need that because they're trying to make sense of it.
Yeah. Yeah. So asking them, like, do you want me to listen? Do you want advice? Yes. You just need a safe space to watch
beautiful
crappy TV together.
You have to be there with me.
Yeah.
Yes.
I gotcha.
Because they know, a lot of people know this is not good. This is not good. Why am I keep going
back?
Pull
themselves out.
Right.
I get that. And then I think, we hit on a little bit about physical things that happen to our body when we are holding trauma. I want to talk a little bit about that because, our primary care physicians are seeing fibromyalgia, we're seeing migraines, we're seeing, all of these things that are related to trauma. Can you tell us a little bit about that?
I'm so glad you brought that up. So one of my heroes is Dr. Gabor Mate.
Yes, me too.
Love Dr. Gabor Mate.
Gabor
Mate, not A-T-E with like a little hyphen over the E.
So if you're looking for Google that.
Yes. He is amazing. And you can find him everywhere. He wrote the book, When the Body Says No. Amazing book.
Great book.
He has in there everything from fibromyalgia to cancer. So if a person has any physical stuff going on, what is the likelihood of this person healing versus not? And it's the environment with the people, the belief systems. Like I had somebody say to me that they were so overwhelmed and their body literally gave out. They dropped to their knees. And I said, let me paint a picture for you in your mind. When you close your eyes and you think of you just dropping to your knees, what do you picture on your body? The weight of the world.
Wow.
Because that's what was going on. I have to please all these people, from job to home to family, whatever. And it was just too much because their self-care was zero.
Yeah.
Because they just can't, because they're expected to do other things for other people. And then the fibromyalgia and the autoimmune issues, that is all connected because it's stored in the body. It's all stored.
Sense.
Mm-hmm.
Yeah.
Heart attacks. Men have high rates of heart attacks. Why? How many men, especially in the Generation X and boomers, thank you, they have higher rates because they all stuff it. They don't talk about it. Emotions are weakness. I don't talk about my feelings.
I'm a man.
I'm a man.
I'm not allowed to cry.
Right.
I need to be the strong one.
Yeah. And showing vulnerability is courage.
It really is.
It really is.
It is. Yeah.
So all those physical things, the mind-body connection. So we're moving more into that, I think.
Yeah. I see a lot more, at least, on Instagram and in the news. And we are leaning more into it. What happens when you have stress in your body? Like, what biologically happens to us?
So what biologically happens, our brain changes. Your neurotransmitters, like the anxiety, the GABA neurotransmitter, that's one of the connections with that. So everything is offline. Everything is wackadoodle. You may have too high of this, too low of that. So having a provider who, not just primary medical, that's like, here's a pill. You want someone like functional, integrative, where, you may be lacking in different vitamins. So you want to make sure you have the nutrition and maybe magnesium, or maybe any type of
vitamin D,
vitamin B, vitamin 12, complex types of things.
Yeah.
All that, and memory stuff. And Dr. Daniel Amen is another person.
So good.
The Amen clinics, and he has all that too with the brain, the memory, and all his supplements and stuff are all natural. So anything related to knowing what your blood levels are, the glucose. So even thinking about your endocrine system and your glucose. I have some people who cannot lose weight because the glucose is so out of whack. Yeah. Sometimes it's normal, sometimes it's not. Well, that's stress, because the cortisol level all goes into the endocrine system.
Yeah. And when you have those high cortisol levels too, your body is just fighting internally. That's what the picture I get in my mind is, just your body kind of battling itself.
It is.
Because it's not supposed to hold all of that.
Eczema.
Yeah.
Skin. Anything related to skin.
Yeah. I see people a lot of times too, burnout too, in this profession, mental health. Mm-hmm. And, we never go through the full tunnel of our emotions. Not always, but that's when we get stuck. If we're not able to feel an emotion all the way through, we're stuck in that tunnel, which is our body, and it's held there.
Yeah.
Being able to feel all of those feelings all the way through. You may not find a solution to them, but allowing yourself to feel, whether it's crying, laughing, talking to a friend, but especially in our profession, when you just hold it all in, we're human beings, you have emotion to this. And even this kind of goes back to trauma too, is sometimes that trauma's too hard to look at in the face. And that's why we stuff. That's why we hold it inside, because I don't want to feel that. It's too heavy for me. And it's kind of like a biological response to help us stay intact, and I'm sure you see a lot of that when people come to you as well.
And that's where the behaviors come in, where they stuff it. And it could be anything behaviorally, from addiction, with drugs, alcohol,
coping mechanism.
Any coping mechanism. Could be food, shopping, gambling.
Yes.
It could be anything.
So replace or get some relief.
Yes. Because the emotions are too much, that they want to just escape it.
Just for a little bit. And
I'll never forget when I was at Orlando Recovery Center, when one of the patients, she said, "Renee, I'd rather be high for 5 minutes than feel that emotional pain." It broke my heart.
Oh. And I think that's how a lot of people feel. Let me just get away from this. I don't know how else to do it.
Yeah. And the one thing, this is newer in the research. I don't know if you've seen this yet. The talk therapy, if you're repeating the same thing over and over and over, is actually more harmful to the brain.
I just read that too. Absolutely.
And so if I'm talking to you about the same thing over and over, it makes more of a concentrated memory, but that memory can change as well. And it's not healthy. So the talk isn't good. Now, to say I'm not saying don't talk about stuff. Absolutely not. I think that's important. But if you're repeating the same trauma stuff over and over, that could be detrimental to the healing process.
Makes sense to me. Yeah.
Just the way the brain, the neuroplasticity, and
you're kind of reliving that trauma over and over again.
Yes.
Yeah.
And
without
concrete
getting through that tunnel, experiencing it, and then we move forward.
Right.
Which is where therapy comes into play, where coming in for care and being able to feel vulnerable.
Oh, that's huge.
Yeah, I think so too.
The vulnerability component. And
you don't always have to be strong, or even as a woman, nowadays we work full-time jobs, then you come home and you care for your kid, and then you do the laundry, and then you do all the housework. You don't have
never ends.
Never ends. Yeah. So for women, it's especially, and you see, gynecological, or you talked a little bit about menopause, perimenopause too, and our hormonal levels are all out of whack, and not many people talk about that.
I have to give a shout out to one of my clients who brought that up to me, because we were talking about it because we were at that age, and she's like, well, that's because of this. And I'm like, I didn't know that. Like dryness in the ears.
Yes.
My ears were so itchy, and I'm like, that's what that is. And she goes, yeah, you think about it, dry because your hormones and blah, blah, blah. And I'm like, that's impressive. So
interesting.
Educating my clients in that as well. So even the concentration, when I had started a new job years ago, and the new program, the computer program I had to learn, it wasn't hard.
Right.
I couldn't retain it, and I was in tears. Oh, Renee, that's because of this. I'm like, nobody talks about this.
Absolutely. Especially, I feel like there's been a little bit of a spotlight on perimenopause lately, but nobody talks about it, or, it's this taboo almost still to talk about menopause and to talk about that, and you don't know. And a lot of times your doctors don't tell you either.
No, they don't.
So I think for someone who's, my age, middle-aged woman, what could you do to look for someone who is going to give you integrated care?
Yeah, you need to find people that, unfortunately, most of these people don't take insurance. And so that could be a barrier. But they're out there.
But there's also good podcasts out there. Yes. There's the experts in the field where, I learned quite a bit from just listening to podcasts.
Me too.
Reviewing journal articles too.
Yeah, that's a good point. Yeah, I think even like a nutritionist, like there's some that are integrative. I refer a few people.
Yeah.
And I know there's an actual physician in Kissimmee. He's not seeing new clients, but I know his practices. He does more integrative. He will prescribe, psychotropics or whatever medication there is, but he's more to the holistic. And I like the holistic.
So maybe look for holistic care, or and you can even ask your doctors, like, what is your viewpoint, or what is your practice on this, that, and the other. And there's quite a few integrated medicine practices nowadays as well.
And I think DOs maybe more so in that vein as well. I'm always looking for new people to add to my list of recommendations.
That's awesome.
And the holistic, and also, like the energies, like vibrations. I do sound bowls.
Interesting.
I have 4 of the 7 chakra sound bowls that I utilize to help with my clients, because the vibrations are healing, because they're all different vibrations.
What?
And I use that before I do hypnotherapy with my clients to get them in a deeper trance. And majority of my clients, well, I just say majority, all of them that do it love it.
Yeah.
And it's just so relaxing and peaceful, and it's easier to go there.
Yeah.
To go into the stuff that they need to process.
Physiological.
It is. You'll have to come see this one time.
I did want to see this. I just learned a little bit about vibrations when me and my son went to New York, and we went to the museum. They had a butterfly, what do you call it?
Exhibit
where the butterflies can land on you and do all that. And there was one butterfly that landed on my son's leg and wouldn't leave. And we were talking to the butterfly expert, and they said that the butterflies could actually feel the vibration.
I love that. Well, your son is amazing, so that doesn't surprise me.
It is interesting to me. And then we started researching vibrations, and it's such a real thing. And they say that 20 feet of another human being, you can pick up and feel someone's vibrations.
That's
So,
amazing.
if you've ever walked into a room and you just feel kind of like the energy of someone or like their smile, or it's a real thing. There's a biological reason behind that.
Oh, I totally believe it.
Or if you feel someone's sadness, which a lot of therapists are very emotive, and you feel that empathic, when someone walks in who's sad, you can just feel that inside of them too.
Mm-hmm.
It's interesting.
And as a therapist, and this, just we have to ground ourselves all the time too, and to protect ourselves from not getting, that empathy to getting to where it's gone. So we have to replenish.
Right. And it's on talking about that secondary trauma. I think a lot of therapists, first responders, can you talk to us a little bit about what is secondary trauma and what are some of the signs and symptoms?
It's more, it can be the trauma stuff too that you're picking up and you're not processing it and working through it as well. Because if you hear day after day after day of this stuff, what do you do with it? And you made some good points, like my sister is my quote unquote therapist. We talk to each other almost every day. And, I'll just say, I had a really tough day because my heart went out to this person that, blah, 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 or whatever. And, HIPAA, of course, I'm not going to say names or details, but it's just knowing that it's okay, that, your feelings are valid, or just talking about it. And I've learned a long time ago from one of the people I worked with, and I don't know, it was a visual in my head, that she's a psychologist, that when she walks out that door, she has a visual in her mind, the door is shut. So that allows her to leave the work behind. So she doesn't take it, personalize it into her home, which of course I'm a private practice, so I do take work home anyways, but have that visual metaphoric symbolism.
The picture of that and allowing yourself, I think, to unload it. That makes sense to me.
And also what really helped me is my ego. So my ego, we all have an ego.
That's true.
Taking that ego and setting it aside, that anything people talk about, it's never about me, no matter who you are. So if I am like, okay, why am I personalizing this? Let me look at what this is. And then, okay, that's because of this from when I was 10 or something like that. Yeah. But then, always looking at within can help also with that burnout, so that I don't take it like that person says it activated my system. So then, okay, I need to do some work myself on this.
Yes. Yeah.
Constantly looking. Right. And then also just checking my ego. This is not about you. This is not about you, Renee.
Yeah.
And that does help.
Yeah. No, that makes sense. And for like our first responders and individuals that maybe work in an ER versus doctors that see trauma a million times a day, like how can our bodies...
Well, you're hypervigilant. You're hypervigilant in those states because you have to give that first responder care. And so I think the physiological stuff that people can do in those situations is going to be more key.
Okay.
And the grounding. Maybe not so much talking, but more somatic work.
Like what's one technique you would recommend?
So eye movements. People can do eye movements anywhere.
And how do you do it?
So you take I can do it with you right now. So you're going to keep your head straight, and all you're going to do is move your eyes back and forth. And so my hand is going to go back and forth, and I could go a little bit faster or slower. And that actually replicates REM sleep. And so you have a more relaxing effect. And so somebody could do this for you, but sometimes you can even just look at 2 points on a wall, picture something, and that has a calming effect physiologically. And then take a deep breath.
Actually did.
Yeah.
Yeah, really did.
That was an awesome.
That's really cool.
Yeah. So eye movements, because the eyes are connected to all the centers in the brain. So even find 2 points on a wall, look at your feet, back and forth, back and forth.
The experience really was in my head, actually. Like I felt like everything just settled. Really weird.
Yeah. Now even imagine, okay, there's a picture in your mind. Maybe somebody just pissed you off on the way here. And that picture of that person, right? So what I would even do, like there's another technique where, you see that person in your mind, and I move my hand back and forth, and you could color over it, you can erase it, you can do symbolism. I don't want to give it all away, but there's things that I do with ART that, erase and replace, and it works. And so
And
you're
it's changing what's going
Yes.
on in your brain.
and in your body
In your
at the
body.
same time because you're being mindful. You're watching my hand. My hand is just a tool to help you move your eyes back and forth.
Okay.
So you're mindful of watching my hand, so you're not actually going to be thinking about other stuff.
So if I'm looking for a therapist who does that, what would I look for?
So the ART.
ART.
So ART, there's actual accelerated resolution therapy websites. So there's international, and then the accelerated resolution therapy. I don't know if that's still the Laney Rosenwald Foundation, but there's the two. So if you just type in accelerated resolution therapy, it'll come up.
ART, got it.
And then you'll type in whatever location that you're looking for.
That's awesome.
Now, not all ART therapists are in that because you have to pay to be on those websites, of course. So some you can even
Maybe
put
like ART near me.
yeah,
Okay.
yeah, something like that, or Psychology Today, or what.
I think for people out there, who have unresolved trauma or a loved one that does, I think looking for ART, trauma-informed care, and that's huge when you're looking for inpatient programming, where you're looking for a counselor, and having the knowledge, having your therapists be and have the knowledge to work through those things with you is key.
Yeah, because you want to go from the hyperarousal to optimal arousal.
Yeah.
That's the goal.
That is the goal. Oh, Renee, thank you so much for being here
It's
today.
been my pleasure.
This was amazing. I learned so much. Thanks for talking with us about trauma.
Of course.
And for all of you who are watching today, please reach out if you are looking for help, you have unresolved trauma, your loved one does. There are resources, there are ways that you can get help today. Check out our websites or some of the resources that Renee shared today. And thank you so much for watching Mind Matters. We're so glad that you joined us today.